Carlson from the Riverside Animal Clinic, and this is our new rescue project, Emma. As you can see that she had chronic burn wounds of unknown origin. We're not sure of her history. She was rescued off a trailer that was going down to Mexico for a slaughter, and a nice gentleman had nice family had saw her and decided that she would be a good candidate, and so she's a wonderful horse, and certainly the length of the wounds that she had were much more extensive when we got her, but you can see that right here, a lot of scaling. This is what they call the subdermis, and this gray area right here and darker area is skin that's tried to come in. You can see the striations here of actually the scaffolding of normal skin, but it's just not able yet to grow fur. And then up here we see a few wounds that come through that are seeping with lymph fluid or serous fluid. Those are kind of the ones, the type of wounds that were originated with the burn.
And this one involves the muscle, right?
Right, the muscle, we can see that right here there was some deviation of muscle structure on both sides here where that's divoted in. There was definitely some muscle damage from the heat and the extension of the granulation tissue here, and the scar tissue is evident of that. And so it's strange because there's a lot of sensitivity because the nerve endings, just like normal skin, go in one direction. You know, if they're going this way or this way. And in burned skin, they kind of go every which way. You know, so it's always really, really sensitive. And so you can even just get close to it and they can start to fidget. So pulled laser is a great way to manage wounds, to maintain circulation. If we're going to introduce medications, we want to make sure circulation is good as well. And so we'll just fire this up for us.
It's okay, girl. Good girl.
You see that? We put it over some of these more chronic wounds here. We're going to get better healing and circulation, and obviously it's going to take some time for all this to come together. We're not sure yet, you know, after the next 6 months to a year, how much we're actually going to get back. Consideration always is, you know, with potential for skin grafting, depending on how much you know, damage there is, you know, permanent damage. But you can already see that there's some fur growing back right there, so who knows, you know, it can all start pulling together.
A little bit right here too. Yeah. A little bit coming back there.
Yeah, see the hair. And then this coat.
She has a very kind eye. You see how pretty you are? And you have a whole crew of friends here, boys mostly, who are madly in love with you because you're such a good girl, Emma.
We're all pulling for it.